The rich also cried amid the epidemic in India. Despair and chaos embraced the lives of poor urban Indians who were unfamiliar with Pinakin Tendulkar, until the second wave of COVID-19 arose. Pinakin Tendulkar, a business consultant living in an apartment complex with a yoga and jogging track in Pune, Maharashtra, India, got a nCoV positive result on the first week of April. Tendulkar's 2 children and mother, a 72-year-old woman with autoimmune disease, also contracted the virus respectively. Tendulkar took many days to help her mother get adequate medical care, but the old woman passed away on April 23. The Tendulkar and his wife were unable to attend the funeral due to being too sick, unable to move, and lying in a hospital bed because of COVID-19. Tendulkar's 388 apartment complex was also blocked, with 55 reported cases of nCoV and 3 deaths. "I couldn't take care of my mother physically and mentally in the last days of my life," the 45-year-old man said. "We were not prepared. The medical system was overloaded. I struggled to find beds and medicine, making things worse." After hitting the poor in India last year, COVID-19 is creeping into the middle and upper classes, with cases being politicians, football players and Bollywood stars such as Deepika Padukone, and among the most famous Indian actresses. Modern apartment buildings in Pune and many other major cities have become hotspots of the pandemic, seemingly showing the power and extent of the spread of new nCoV strains. Experts say India's richer class is also vulnerable to this outbreak, as many people have not developed immunity after the first wave of COVID-19. "The virus has shifted to the middle and upper middle classes," said Dr. Shashank Joshi of COVID-19 Task Force in Maharashtra state, adding that the central air conditioning system and the elevator have turned high-rise apartment buildings become infectious points. The Indian government on May 5 warned that the third wave of pandemic is inevitable, as the virus has spread widely and is likely to appear even more new strains. Last week, the world's second-largest epidemic zone accounted for nearly half of all new infections recorded globally. More than 238,000 people have died from COVID-19 in India, but the actual number is thought to be much higher. Indian leaders have said that they managed to contain COVID-19, after seeing the number of infections decrease earlier this year. However, the loosening of preventive measures sparked a viral resurgence in March, leaving the health system nearly down. The COVID-19 vaccine has also become scarce, although India is the largest producer of vaccines in the world. Patients who have stabilized, but have not fully recovered, are also being discharged from the hospital so that the doctors can accept serious cases. "This wave is much worse," said Smriti Kulkarni, COVID-19 patient in the city of Pune, said. The 39-year-old lawyer, who has just been removed from the intensive care unit, is trying to curb severe and persistent coughing spells. At least 17 countries have detected the Indian nCoV strain, or B.1.617, prompting many governments to decide to close borders with passengers from the country. Many wealthy Indians are said to be pouring money and fleeing private jets to places that still host them, like the Maldives and Dubai. In the city of Mumbai, India's financial center, a COVID-19 operation room was set up to help residents find hospital beds and ventilators. The people who work here said that the prayers for help came mainly from richer neighborhoods, instead of the poor. To date, panic has not yet enveloped Dharavi, a famous Mumbai slum with nearly 1 million residents living in cramped rooms. The G North area, where Dharavi is located, recorded only 17% of all infections from this slum in April, while Dharavi accounts for 70% of G North's population. This figure is consistent with reports that 90% of Mumbai nCoV infections are detected in apartment buildings and outside of slums. Despite concerns about Dharavi, where more than two-thirds of its residents share 450 public toilets, officials hope residents have developed immunity from the first wave of COVID-19. Kailash Jethwa, a resident of Dharavi, said authorities still come to regularly check their body temperature and conduct tracing for cases. Meanwhile, a protracted crisis could wreak havoc on India's middle class, which has been growing steadily for decades, until a pandemic strikes. The Pew Research Center estimates India's middle class fell 32 million last year, while the number of poor people increased by 75 million. Before the outbreak of COVID-19, Jimmy Tiwari lived comfortably as a teacher in Pune, despite being a single mother with one son. However, after losing her job in March 2020, the 42-year-old woman quickly ran out of savings and had to live on her parents' in order to hold out. She and her son ate mostly lentil rice every day. I don't remember when the last time I went to shop, or ordered food from a restaurant. Before, I didn't even have to think about such small pleasures. But with the second wave of COVID-19, they become distant, says Tiwari.